World AIDS Day was first observed in 1988 on December the 1st, and in the 31 years since, many organizations and individuals across the world have brought attention to the HIV epidemic on that day and year-round. A local organization, iDeserve Inc., is one of those organizations this year bringing knowledge and awareness about HIV and speaking out against the stigma through a virtual conference.
We host the conference every year virtually, and it's Deserve whatever that year is. So this year is Deserve 2020. And our focus for this year is World AIDS Day. And so we've entitled the conference Deserve 2020, A Better Tomorrow Today. We'll basically be focusing on HIV and AIDS and the World Health Organization / the CDC as well. Their goal to end the epidemic by 2030. We're going to discuss whether or not that's possible. What hope is there of ending such a virus?
This is a fitting time for Battle and his organization to use this as the focus of their conference. According to HIV.gov, this year's overall theme is Ending the HIV Epidemic, a Plan for America. The goal is to reduce new HIV infections by 75% by 2025 and down by 90% by 2030. Battle saw a need through his organization to raise awareness. Each year since 2014, iDeserve Inc. has focused on some form of mental health and wellness, and this year is no different.
Well, in 2016, iDeserve developed I guess you could call it an advisory board of sorts, called the Pastors Roundtable. And we got together and we discussed how we could better serve the congregants of our different churches and the community members. We realized that quite a few of our congregants who are HIV positive were being neglected. Their needs were not necessarily met in ways that we could actually help, simply because most of the pastors involved didn't have very much knowledge in that regard. And so we started a curriculum specifically aimed at encouraging education and enlightenment as it pertains to sexual health, because that's not something you get a lot of information regarding in church. Plus, I myself am HIV positive. And as the founder of iDeserve, I really thought it made sense for me to minister to a community that I am not only aware of, but am a part of.
Ooh, I knew this was the type of work for me when someone asked me, what would you do if a member in your congregation had HIV? And then it opened the floodgates of what I didn't know, what I didn't have to protect them, what I didn't have to protect our members. I mean, just from the ignorance of how do we protect our members to the other ignorance of how do we protect them, from their safety, what goes into it, what's the doctor's appointments, what's the bill, how much does the medication cost, is there medication? Because, there's always that adage that, Magic Johnson got cured, but, all the rest of us, we just pass away. And so the whole concept of it is that I had to really start to look within and realize I'm in a position to help people and I don't know how to help them.
More than 700,000 American lives have been lost to HIV since 1981, and more than 1.1 million Americans are infected. According to the Georgia Department of Public Health, Chatham County has more than 1,900 people living with HIV as of November of 2019.
I'm proud to say that I serve the community of Chatham County in Southeast Georgia and offer PrEP and PEP services. And I know that we're going to talk about that. I've been involved in HIV medicine for about 6 years. And again, I'm very passionate about HIV medicine.
Right, well, there was a lot of fear of the unknown. And I met my first HIV positive patient as a medical student at Grady Hospital in Atlanta, Georgia. And at that time, we treated individuals like they were contagious. And we wore gloves, 2-3 pairs of gloves, masks, disposable gowns, disposable stethoscope, and we had many effective treatments at the time. And we still have not understood transmission and things like that.
The HIV team here is amazing. Second to none. And so we're really excited to be able to work with some of their members, some of their prevention team members. We'll be able to talk about things like the clinical trials that are featured here in this district. The Coastal Health District is a part of those clinical trials. We'll discuss that. and the impact on the community right here. So we're really excited about that.
According to hiv.gov, there is a risk of an HIV resurgence due to several factors, including a lack of access to HIV prevention, testing, and a lack of awareness. Things that Battles Conference want to address with the help of local and national health professionals talking about prevention and more.
My motto is know your status, whether it's negative or positive. There is life outside of after a status, after you find out your status. So I think if everybody would take that initiative to just go and do it, there's still fear from a test even. I find many people today getting their first test, even though they've been sexually active for many years. I think it should become a routine. It should be a common practice. So if everybody in this world would actually get a test, where would we be? I think it would be amazing. People can continue their life, know what they have to do, and move on, So that's my motto.
We're not specifically looking at any one community. We're looking at homosexual individuals. We're looking at heterosexual individuals. We're looking at just the population in general, right? And we need to make that distinction. There are still a lot of people that think that HIV only affects homosexuals, and that's just not the case. It affects anyone, doesn't matter. Skin color, the amount of money you have in your bank makes no difference. Equal opportunity offender.
Every day that week at 7 a.m. and at 9 a.m., TB Fitness here in Savannah will be providing us with a 5 to 10 minute physical fitness session where you'll get group training virtually. And we are so excited about that. We'll also have some awesome thought leaders, Pastor Chauncey McGlathery, who will be presenting. He just got finished presenting with the Georgia Department of Public Health for one of their public health conferences, and he'll be also bringing that subject matter to us. I myself, G. Allen, will be speaking. We've got some of the public health professionals here in the Coastal Health District in Savannah who will be working with us as well, and we're really excited about that.
One of those organizations and healthcare providers that is working with the conference is Starland Family Practice. They offer primary care for adolescents ages 16 plus and adults in the greater Savannah area with the focus on the LGBTQ community.
Very queer-focused, LGBT, community-driven. It's something that when I moved down here 9 years ago from New Jersey, realized was greatly lacking in the Savannah area. So that was part of my motivation to start the practice, get it up and running. And it's been great. There's a huge community here in Savannah. We have patients that travel from 2 to 3 hours away to come to get care with us. Also, the advantage of our practice is we do general primary care medicine, but we treat HIV, transgender care, and we can keep a lot of that stuff in office versus needing to refer to a specialist.
One of the other components of the conference is a TED Talk style presentation where some of the local healthcare providers get to speak on their different perspectives on HIV as well as their work in the field.
Everybody can't be in the fight against HIV to the same level of dedication and time and commitment, because there are other important issues facing not just our families, our communities, our states, our nations, but the world. And I think about cancer research, I think about diabetes, I think about a lot of other illnesses that have a negative impact on the people of the world. So we need to keep having the conversation because we need to keep it fresh.
We need to have the conversations. Conversations that we want to have can be as simple as, I didn't realize HIV is still a problem. What are we doing about HIV? Going to your provider, saying, I didn't realize that I may be at risk for acquiring HIV. Can I get tested? That type of thing. Having individual conversations, moving yourself forward. My goal as an HIV medicine provider is to make sure all of my patients are safe.
Prevention is also important. Think about in our communities, how often do you see someone providing free HIV testing, right? How often do you see a sign on the side that says HIV? Some statistics about HIV. We see a lot of no smoking, chronic illnesses, but HIV is still a stigma in our communities. I can remember my mother providing free STD testing down in Glenn County, and it made headline news. Why? Because there was stigma behind the STD testing. That big sign that was up there was a big issue. So we need to continue the conversations.
Ahead of the virtual conference, the organization will host a free HIV testing event on November the 19th and the 20th at Victory North on Whitaker Street in Savannah, Georgia. All of this information and more can be found at gallenbattle.org. On the national level, their hope and theme is to have a cure by 2030. Some of the local healthcare providers also feel that there is hope, as there has been a lot of progress in medicine and the way HIV is treated.
There's a lot of hope. If we're looking specifically at HIV, whether someone currently has HIV, if they're involved in a PrEP program trying to not get HIV, there's hope. We're making drastic steps in providing up-to-date evidence-based research care to our patients. Our modes of providing that care are changing on a daily basis as we get new research in. So not only are patients being proactive right now, but providers are being proactive as well.
I do believe that there is hope. We are getting there now with the resources that we have available. PrEP is amazing. We just need to expand the resources for that. I believe there's hope for treatment. We're seeing more providers starting to expand into HIV care. There are benefits to even for providers going into our rural areas. So there's hope. I think we're doing it. We just need to go beyond that. You know, I think there will be eventually a cure for that. So the rate that we're going now, we'll get there. I do believe in it, and I have hope that there will be zero numbers to new HIV infections at some point soon.
We need to continue to confront HIV on every side. We need to have all the community engagement, all the community outreach. We need to be, in the places where HIV tends to still not be fully understood. College campuses, high school, middle school, churches, at family reunions, and our sororities and fraternities. We need to have the conversation that this is a disease, this is a one-time, a global pandemic, not like it is now, but something that if we are willing to confront and attack, we certainly can defeat.
And I think hope. I truly believe as we look forward into the next decade that if we don't have a cure for HIV, we'll be really close. So we need to hang on, and we need to do everything we can to get the transmission rate at this point today down to zero.
The virtual conference will be November the 29th through December the 5th and is free, but registration is required. And you can register today at gallenbattle.org. This is Kareem McMichael reporting. Welcome to Deserve 2020, A Better Tomorrow Today, virtual conference this year. Thank you for being here with us and joining us today.
Thank you for having me.
So we want you to tell the people watching and everyone watching who you are and just a little background of your title and what you do.
Okay, so my name is Katrina Howard. I am the lead communicable disease specialist for the Coastal Health District, which is also a part of the Georgia Department of Public Health. And so what I do is I surveillance communicable diseases in reference to HIV and AIDS, gonorrhea, chlamydia, and syphilis cases for our district. And I've been doing that now for almost 10 years.
So that's been a while. So tell us, prior to those 10 years, when did you know that this was the work for you, and why do you have a passion for it?
So I actually, I consider myself a baby of public health. My mom worked in public health for 36 years. So I ran the halls of health departments for many years. I can recall going to health fairs, playing with the equipment and everything, and just not really knowing that this would be something that I birthed into today. I became really passionate when it hit home in reference to HIV with a family member of mine. So that allowed me to do more research, learn more about HIV and AIDS, so I could just help my family members. So who knew in 2020 I would have now been 10 years in. So I continue to do what I do. I'm passionate about it, and I love it. So I'm all about helping people.
Why do you believe the conversation surrounding HIV prevention and care is still relevant?
I think it's really relevant, even more now. We've come a long ways when it comes to HIV and AIDS. And I do believe that we will be at a cure at some point. So now more than ever before, we need to push the conversations. We need to get the education out there. We need to educate our providers, our schools. I also believe that policies need to change so it can adapt more to what's needed with our care. So the conversation needs to go even more at this point. We don't need to stop it at all.
I certainly agree with that, and I think a lot of people sometimes, in different professions, not even just healthcare, but even specifically with this one, and with an election season just passing, maybe think about that a lot of times there's a lot you can do on the ground level, but policies and other things to affect change. Or when they don't change, they also kind of affect how things unfortunately stay the same sometimes.
Exactly.
And we don't, results aren't yielded. So I think that's an important part of that overall conversation too, from us one-on-one,
right,
and then in the community, and then our elected officials, the policymakers. That's a very strong point. And what are some things, like one thing that you believe or feel that every individual can do to stop HIV?
My motto is know your status, whether it's negative or positive. There is life outside of after a status, after you find out your status. So I think if everybody would take that initiative to just go and do it, there's still fear from a test even. I find many people today getting their first test, even though they've been sexually active for many years. I think it should become a routine. It should be a common practice. So if everybody in this world would actually get a test, where would we be? I think it would be amazing. People can continue their life, know what they have to do, and move on, So that's my motto.
A great motto. It helps in a way then, routine checkups, just making it a part of your general health care. Then with that and other practices, do you feel that there's any real hope in reducing HIV numbers in the U.S., especially specifically in the South?
Yes, I do believe that there is hope. We are getting there now with the resources that we have available. PrEP is amazing. We just need to expand the resources for that. I believe there's hope for treatment. We're seeing more providers starting to expand into HIV care. There are benefits to even for providers going into our rural areas. So there's hope. I think we're doing it. We just need to go beyond that. I think there will be eventually a cure for that. So the rate that we're going now, we'll get there. I do believe in it, and I have hope that there will be zero numbers to new HIV infections at some point soon.
What are some other ways with this hope? How do you think we can make this hope a reality? What can people do, or even what more do you want to do or can you do that we can make this hope a reality?
I think that we need to stop looking at HIV and AIDS as a subject that's hush-hush, something that we can't talk about. Continue to have those conversations. Our providers should be on board. Just like you get your testing for diabetes or high blood pressure, we need to make sure that we continue to have that a routine, not basing it off of a person's what they look like, or are they heterosexual or homosexual. I should get my blood pressure the same as with my HIV. I shouldn't have to ask for an HIV test, and that makes sense. If we get to a point where this is normalized, I think that will get us where we need to be.
When you hear the phrase, I dream, speak, and receive victory, what first comes to your mind?
I started to think about getting to zero. I think about 0 new infections, and what also comes to mind is 0 deaths. I think I know there's hope when it comes to what we have now for HIV care, HIV prevention. And I just have hope that we're going to come to an end with this. There will be a cure. And I look forward to that day. Having somebody dear to me who passed away with HIV and AIDS, that was tough for our family. So I look forward to the day that no one will ever have to go through that again. And so that gives me hope to keep going.
Thank you so much for being here with us today and a part of this conference. We appreciate your information and your knowledge, and continue the work that you're doing.
Thank you, and thank you for the opportunity.
We are here at the iDeserve 2020, A Better Tomorrow Today virtual conference, and want you to thank you first of all for doing this interview with us.
Absolutely.
Let the people watching know who you are, what your background is, and then tell them a little bit about what is PrEP.
Great. First, I want to say thank you so much for inviting me to speak. It's an honor to really be part of this, the presentation today. My name is Joshua Keys. I'm a family nurse practitioner, and I'm proud to say that I serve the community of Chatham County in Southeast Georgia, and offer PrEP and PEP services. And I know that we're going to talk about that. I've been involved in HIV medicine for about 6 years. And again, I'm very passionate about HIV medicine. So you had mentioned, what is PrEP? So it's a real loaded question. If we were to summarize what PrEP is a way that we can offer treatment to a patient prophylactically. So PrEP stands for pre-exposure prophylaxis, right? So all that means is that we're offering treatment to someone in the form of medication to help prevent them from getting or acquiring HIV, right? So before an action would take place that may put them at higher risk to acquire HIV. And the way that PrEP services are delivered across the US, it's really kind of like a protocol. It's a plan of care. So when most people think about PrEP, they think about medication. And yes, that's a part of PrEP, but also we develop, as practitioners, we develop complete plans of care. So we get to know our patients very well. Everything's confidential, and we see how we can best meet their needs. So most of the time, when PrEP is delivered, there are 2 medications that we offer that the FDA has approved for PrEP, and those are Truvada and Descovy. Most people have heard of those, and they're very simple to take. It's 1 pill once a day. For maximum effectiveness, you want to make sure that you're taking it once a day, and you get maximum effectiveness after 30 days of taking the medication. So we have that slow kind of buildup of the levels in our bloodstream, right? Side effects of Truvada and Descovy, very minor, right? Normally, maybe some GI upset, so a little stomach ache, a little nausea. The nice thing about the PrEP protocols is that we get to see our patients at least every 3 months. And what we do on those monthly, every 90-day visits, let's say, is we reassess. Does someone still need to be on PrEP? But more importantly, we draw blood, right? And we make sure that there are no negative side effects to someone taking the medication, right? So if there are other options, right, that we have. But first and foremost, PrEP is all about patient safety. So from the provider perspective, we're making sure our patients are safe. And from the patient's perspective, they're making sure they're taking that proactive step to help prevent the spread of HIV and acquiring HIV.
I think that's a kind of good segue into the next part too. So as a part of why should it be an easy choice, or should they even consider if you're sexually active, yes, PrEP?
Yeah, I think the question is actually a great question, because we're not specifically looking at any one community. We're looking at homosexual individuals, we're looking at heterosexual individuals, we're looking at just the population in general, right? And we need to make that distinction. There are still a lot of people that think that HIV only affects homosexuals, and that's just not the case. It affects anyone, doesn't matter. Skin color, the amount of money you have in your bank, makes no difference. Equal opportunity offender. So we need to make sure that we're keeping that in mind, and we want to make sure that that providers and that our audience is being proactive enough to kind of take that step to ask their provider about PrEP services. One of the largest barriers that I've seen is people anticipating that PrEP is going to be very expensive. And if someone were to throw Truvada or Descovy into one of the internet search engines, it's going to show it's going to cost $3,000 a month, right? That's what it's going to show. However, everyone's financial situation is a bit different, but for about 95% of my clients, they qualify for an assistance program through the manufacturer of the drug. And then there's some type of calculation that's done. And for, again, like I said, over 90% of my patients, their out-of-pocket cost for the medication is $0 a month. So it's literally free, right? I also think that there's some misinformation also about long-term effects of some of the PrEP medications. And I want to make it very clear that when someone is enrolled and actively participating in a PrEP program, that they will be seen by their provider every 3 months, and blood will be drawn. We're going to make sure that all of their body systems are working just as they should. From a barrier perspective, I think we've overcome a lot of them. It's just getting the right information out there in order for people to make that step to walk in the door.
And that's very, very huge. And I'm actually glad you talked about that, because a lot of times, I can't remember who I was talking to a few weeks ago about something similar in the healthcare and medical providing world, that a lot of times there's not only a lot of misinformation, but people don't know about these programs that are out there to help them, especially depending on their situation. And sometimes it may be just, a lack of them knowing to think to ask, but then sometimes the provider or the practitioner doesn't tell them either.
Absolutely, and I think we'd be remiss if we didn't mention that there is a stigma associated with asking anything about HIV, right? So there will be general assumptions made about someone's behavior, possibly, if someone asks that question. So we need to have those conversations, and I'll talk a little bit later in the presentation about that, but we need to make sure that we're talking openly and honestly to our provider, and each person is responsible for their own health, right? So if someone's taking the step to be proactive, to try to not get HIV, if you're hearing from your provider that you don't need to be worried about HIV even though you're sexually active, it may be time to look for another provider, right? So we want you to be proactive. We have all the tools necessary to make you succeed, right? We just need to have the dialogue in order for it to happen.
And speaking of dialogue, when you hear the phrase, I dream, I speak, and receive victory, what first comes to your mind?
When you say that, I actually get chills, because it's hope is what comes to mind. There's a lot of hope. If we're looking specifically at HIV, whether someone currently has HIV, if they're involved in a PrEP program trying to not get HIV, there's hope. We're making drastic steps in providing up-to-date, evidence-based research care to our patients. Our modes of providing that care are changing on a daily basis as we get new research in. So not only are patients being proactive right now, but providers are being proactive as well. So again, I think hope. I truly believe as we look forward into the next decade, that if we don't have a cure for HIV, we'll be really close. So we need to hang on, and we need to do everything we can to get the transmission rate at this point today down to 0, right? We're not there yet. We're getting the tools in place to get there. So we need to work those tools and utilize those tools the most effective way possible. But if we're looking forward 10 years, I really feel we're going to either be there, we're going to be very close to a cure. We just need to hold out until then.
Josh, thank you so much for doing this.
Absolutely. My pleasure. Thank you.